guys, welcome to another video. My name is Bapi and I'm certified personal trainer from Norway. And today we're going to talk about how you can reduce the progression of hair loss and how you can even regrow for some people. It depends on the person themselves on how they respond to these medicaments. I'm just going to walk through the different medicaments and protocol I have been doing for over 1.5 years now, and I've been seeing tremendous result personally. For some of my friends who also tried some of the medicaments, they saw also really good progression of the improvement of their hair quality. This will be a long video for about 25-30 minutes, so keep in mind. And here are written notes: Minoxidil, pharmacology, Finasteride, topical anti-androgen RU 58841, reducing DHE, so everything, okay? Obviously, for us men, unfortunately, we are exposed to much more androgen compared to women because our primary hormone is testosterone. For some of you know that the primary hormone of women is estrogen. So, you know, when testosterone metabolizes into DHT, and it's, by the way, testosterone can metabolize into two ways. One of them is by aromatizing into estrogen, and the other pathway is to 5-alpha reductase, which will actually metabolize testosterone into DHT, which will act on several tissues, for example, prostate and hair follicles. And there are, in our body, there are AR expression, androgenic receptor expression in brain, liver, for example, prostate, hair follicles, some of the tissues. And in these particular areas, the hormones will respond really well because of the AR expression, and of course it depends on the receptor sensitivity, and even for some people, depending on the genetic wise, they have an overexpression of AR in certain tissues, so you have to keep that in mind. For example, some people have overexpression of androgenic receptor in the hair follicle, so in that way they can really be it can really affect their hair, so depending on person, genetic wise also. Before we move on, please like the video. This takes a lot of time to make and edit, so it's just my passion to help you. So yes, Minoxidil 5%. So Minoxidil is one of the medicaments you can use, and this is actually a medicament where it was used back in the days for hypertensive patients, meaning that hypertensive patients, they came in to the clinic, to doctor, and doctor gave him this as a pill. And little as they know that the side effect was increased hair growth to the body, because they were taking this as a pill, it was going systemically to their body, acting as a side effect profile, for example, increased hair growth generally. And then they were thinking to make it as a topical spray, meaning topical spray localized, so the hair growth can happen in a localized area, particular area. So that is why Minoxidil came to the market, and is actually FDA approved along with the Finasteride. But the mechanism here is that it vasodilates. It means that it dilates the blood vessel, so more oxygen, nutrient can go into the area where it's supposed to go, and also in that way their side effects because of the vasodilation can also drop in blood pressure. And so you have to keep in mind to really be aware. If you're already going on some medicaments, I really don't recommend going on Minoxidil, depending on person, of course. If you are completely healthy, if you're not on any medicaments, of course the side effect profile is really tolerable, and most people, they won't notice significant side effects. Like me, I didn't see anything, so that's really good. What it does is that it's opening up potassium channels, and it's vasodilates. So more nutrient, for example, vitamin B, which is important for hair, skin and nail, it can really affect the hair follicles. Because you're spraying it on the scalp, it will affect the area you're spraying in, and it can promote growth for your hair because it's a strong growth agonist. You know, when you use Minoxidil for the first weeks or months, you can see hair shedding, meaning that some of the hair which are on the telogen phase, meaning that, you know, hair go in different phases, anagen, telogen, for example, and the anagen phase is the growth phase, telogen phase is the resting phase. So when the hair is on the telogen phase, the resting phase, the hair will start to fall out when you use it. But don't worry, this is just a shedding, meaning that this is not hair loss. It's different between hair shedding, hair loss, diffused hair thinning. It really depends. So when your hair is shedding, your hair follicle will actually promote new hair growth in the anagen phase, the growth phase. So you will have possibly much stronger hair and more denser, depending on the person. But typically you have to do it for 4 to 6 months to see decent results. But keep in mind that not everyone is responding well to the minoxidil, because the thing is, roughly about 40 to 50% of people who use minoxidil will respond really well. The reason behind this is that some people can lack the enzyme which converts the minoxidil into the active phase, to the active minoxidil substance, which will really act on the hair follicle. So that is why I'm telling people to combine both minoxidil and microneedling, because it can give you, let's say, 1 + 1 = 4 effect. So it can really compound the effect together. So I'll talk about microneedling later. So that is minoxidil for you, and how often you should use it is that, the recommended dosage is 1 milliliter, 1 milliliter twice a day, so morning and evening. Obviously, depending on the person, when you wake up, when you go to sleep, I recommend, let's say, 12-hour apart from each dosage. So 1 milliliter of dosage includes 5 to 6 pumps. So like 5-6 pumps in the morning, and you massage it, wash your hand off, and then you do it in the evening. And keep in mind that your hair will be dry because of the alcohol, and please don't use it and then go to shower, because then it won't, because you need to let it absorb really well. That's the purpose of this medicament. You need to absorb it really well. So if you take it and go to shower, you're actually losing the purpose of the medicament. So keep that in mind. So next up, I have this shampoo called Nizoral. This is actually, both of them you can buy it without prescription in the pharmacy. And the thing is about this Nizoral is that the active ingredient is ketoconazole. This is actually a shampoo for dandruff and to prevent flaky scalp. You see the white flaky things on your head, on your hair, which when you rub your hair, it will fall out. So this is the medicament for it. And some studies have shown that it can also be a medicament for actually disturbing the DHT. It can be a mild DHT blocker. Of course, it hasn't been proven yet, but here's the thing. Most of you are using shampoo when you shower, actually all of you. And why not use a shampoo like this, which can promote better hair quality? So in my opinion, this is a no-brainer, and everyone who cares about their hair should use this. And I will talk about male and female approach to these things, this protocol, later in the video. But for now, ketoconazole is actually used for dandruff or flaky scalp, and me personally, I use it every other day a little bit. I put it in my palm, not too much, a little bit, so it can cover my hair. And what I do is that first of all, when I go to shower, I wet my hair, and then I use shampoo, I massage it, I really let it absorb in my scalp, and then I wash my body. Because you want to be time efficient, you don't have time to waste. So the thing is, if you use it after cleaning your body, then you have to wait additional 10 minutes to let it absorb, and then you have to wash out. So to be time efficient, apply it in your scalp, massage in the scalp, wash your body, and then you can rinse everything out. So you are really time efficient. And in the pharmacy, they will say use it 2-3 times a week, but me personally, I like to do it every other day, roughly every other day. If I miss some days, that's totally fine. Don't care too much about detail. Just think long-term approach. So use a little bit, massage it, and then wash off. I would say wait at least 10 to 12 minutes to let it really absorb, and then you can wash out. So that is Nizoral for you, the second medicament, and now the third one. So now I'm going to talk about microneedling. Here I have Dr. Pen, link down in the description. And of course you need needles to be able to use it. And this cartridge has 16 needles, and you can see it on the package. This is a cartridge, and this is sterile. So this cartridge contains 16 needles, you see? The thing is, since it comes in a sterile package like this, you need to keep in mind to wash your hand, be clean, and once you open it, please attach it to the Dr. Pen or microneedling device and you start using it. Don't open the package, let it sit, and then you do something else and come back, because then it's sterile. That's the purpose of this thing, because you don't want infection. So once you apply it, please choose 1.5 millimeter depth, because on this Dr. Pen, you can see here, you have different depth of the needle. So you can, for example, and you choose 1.5 millimeters. Because the thing is, here is the thing, important thing you should know. If you choose too much of the depth, it can actually cut down the hair follicle, and you don't want it to happen. You just want it superficially on top of your top surface, so it can promote increased blood flow because of the micro injuries you are causing doing microneedling, and increased platelet distribution to the area, so it can promote growth factor and wound healing properties. That's the purpose of the platelets, that it has these growth factors and wound healing properties. So that is why doctors use PRP, and I will talk a little bit about PRP. I did PRP about 5-6 years ago because I had thin hair back then. I had thin hair, I have weak hair, I saw hair loss or hair shedding. I didn't necessarily go bald, but it was just a concern for me because I was young and I saw hair thinning. I want to have thick hair. Good hair is good for self-confidence. So I went to the doctor, and doctor, of course, obviously, we're not gonna lie about it. Doctor wanna make money, obviously, and they are recommending PRP treatment in their clinic, so you can pay money. Roughly one PRP treatment costs 400 euros, depending on the area and the localization where you do it. It costs 400-500 euros, depending on the clinic. So each PRP treatment costs 400 euros. So you have to do 4 months separate. So that costs about 1,600 euros. And then you have to wait 6 months. You have to do maintenance therapy for every 6 months for twice, and then every year. So this is really costly and it's really expensive just to get a thicker hair, you know. So that's why I go with this approach, which is really convenient and really cheap. So what I do is that, so I attach it to the microneedling device. I will show you a video here how I do it. So I attach it to the microneedling device, and I start working on the temples, and I start working on top of my head where there's higher chance for hair miniaturization caused by DHT. So when you're doing this, keep in mind that it's slightly painful, but I think everyone who really wants their hair thick and strong, you should be able to bite your teeth and get through it. It's a little bit painful, yes, I agree. Do this with the speed of 1 or 2, because there are different type of settings here. I will show you. So you can see that it has different settings. 1, it has 2, 3, 4, 5, 6. So that was something about microneedling, that you have to choose maybe 1 or 2 speed for the setting, and then you attach the needle, and then you start working on your head, on your crown, on your temples. And here's the thing you have to keep in mind. So the mechanism behind microneedling is that you're causing these micro injuries. You can see erythema, meaning small bleedings. So what you do is that you actually stimulate, you're causing these micro injuries, you're increasing the blood flow to the area you're doing, and in that way you have the increased distribution of platelets, which the platelets want to heal the wound. And actually, when it comes to the area to heal the wound, it's also bringing with them the growth factors, because platelets, thrombocytes, they have growth factors, and they have, for example, wound healing property. For example, when you cut yourself, you can see that the blood will clot. So platelets has a wound healing property. So that is why the mechanism behind microneedling and PRP, when doctors are giving you PRP. PRP is even given for sports injury, so it's really an old method. It's nothing new, and the side effect profile is really tolerable because you aren't taking any exogenous medicaments. You're just stimulating your own body, so the side effect profile is really tolerable. But keep in mind, this is a really important message. Keep in mind, really important, that you don't want to apply minoxidil right after microneedling. You have to wait at least 24 hours. The reason being is that you can imagine, for example, you're punching holes in your scalp, and the purpose of the minoxidil spray is that you want to keep this medicament topically, superficially. You don't want the medicament to really go systemically into your body, causing hypotension. Then if you have hypotension, it can be really bad for some people that they can even faint. You can have symptoms like tachycardia, meaning that your heart will really pump fast to compensate for the low blood pressure. So yes, keep in mind that you need to wait at least 24 hours. Me, if I do it, for example, on a Sunday evening, microneedling, I do minoxidil for the first time on the Tuesday morning. So I wait more than 24 hours to be on the good side. And to be honest, in that way you save at least 2 doses of minoxidil as well. So that's okay. And studies have shown that if you combine both minoxidil and microneedling together, you can actually have a really amazing effect. It's like an exponential effect. For example, you can say 1 + 1 = 4 effect. So they really work together really well. And the mean hair count for minoxidil and microneedling users is much more. And for those of you who doesn't respond well to minoxidil, you can really consider using microneedling. It will really give you a good effect. So now I'm going to talk about Finasteride. So Finasteride was used actually for benign prostatic hyperplasia because, as I explained earlier, AR expression is distributed in the brain, in the liver, in the prostate, in the hair follicles. So in these tissues it can have certain effects. For example, DHT can cause the benign prostatic hyperplasia. So that is why Finasteride is given to old men. Finasteride will actually inhibit the enzyme called 5-alpha reductase, which is converting the testosterone into DHT. DHT is a short name for dihydrotestosterone, which is really important hormone. None of the hormone in our body is our enemy. Everything has a purpose. For example, DHT is really important for libido, for sexual characteristic, and especially during puberty, your genital growth, and it will really cause these things to make you male and adult. So DHT is really important hormone. It's also really important when it comes to muscle density. So it has several effects. So Finasteride can block this enzyme, and in that way you are actually reducing the DHT. Finasteride compared to dutasteride, another medicament which has the same property like Finasteride, which is actually much stronger. Both of them compared, we can say that Finasteride can wipe out roughly about 60 to 70% of DHT in our body, and dutasteride about 80 to 90%. So DHT is much stronger. Because it's much stronger, it has stronger side effects. The 5 mg dose which this pill has is actually for prostate. So what I do, the FDA approved Finasteride dose for hair loss is actually 1 mg a day. So what I do, I take the 5 mg, I put it in this pill cutter right here. You can see. I put it in the pill cutter and I divide it into 4 pieces. In that way, 5 divided by 4, that is 1.25, and I do it every 3 days. So that roughly 3 times a week, I would say. Let's say Monday, Wednesday, and Friday or Saturday. But I stopped using it since January, so I use it only for 1 year. I will explain you why. Me personally, I did it every 2-3 days. So let's say in the end of the week, that was 3.75 mg total dosage. And when it comes to the recommended hair loss dose, that is actually 1 mg a day. So in the end of the week, there will be 7 mg. So Even if I was taking almost half of the dosage, I didn't see any side effects. And by the way, I'm really healthy. And everything depends on you, on your lifestyle. Because if you are obese, if you don't train regularly, if your diet is shit, if your sleep is shit, if you are only on any other medicaments, if your blood work is not in your favor, you can experience side effects. It depends on you and your lifestyle. If you are fit and healthy, your side effect profile can be really minimized and really low. So it depending on you. That is Finasteride for you, and I buy 5 milligram and divide it into 4 because it's much cheaper than buying the 1 milligram dosage. And of course it will last longer. I bought it over 1.5 years ago and I haven't even used 1/4 of the package. So it cost me roughly about 40 euros. I remember back in December 2020 when I bought it and tried it out. And I wanted to experiment how it worked, and to be honest, the 4 medicament worked really well, but I stopped using Finasteride just to continue with the dose 3 because of the unwanted side effects. So the side effects can be, for some people, it can be loss of libido, erectile dysfunction, less sex drive, right? But the main purpose of this medicament is to reduce prostate size, so the urinary flow can be sufficient for older men when they're experiencing urinary problems. For example, they have to wake up in the night to urinate because the growth of the prostate will actually block the urethra, the passage of the urine, so it can be a problem. Another important thing regarding 5-alpha reductase blocker like Finasteride and dutasteride is that when you're taking these medicaments, please don't give blood, or please don't expose these medicaments to pregnant women, because it has shown that it can give birth defects. So be careful. If you don't have baby, please stay off this medicament for minimum 6 to 8 months, because you need this medicament to really clear out of your body before you want to have kids, or even if you try to give blood. Because if you give blood after taking these medicaments, a pregnant woman get your blood, it can be a problem and it can cause birth defects. So keep that in mind. That's really important. And yes, that was the 4 medicaments I have been using and my experience with them. So keep in mind a few things, that you need to wait at least 24 hours before doing Minoxidil after microneedling. So if you, for example, do microneedling Sunday evening, next time you should do Minoxidil is Tuesday morning, okay? You need to wait at least 24 hours. This is really important to not let the medicament get systemically into your body. Another thing I want to talk about, which is really a new medicament in the market, is RU58841. This is an anti-androgen causing blockage of the androgenic receptors, and in that way you're not actually reducing the DHT levels in your body, causing the unwanted side effects which are experienced with Finasteride and dutasteride. So Finasteride and dutasteride actually reduce DHT because it's blocking the enzyme. But this RU58841 is actually a topical non-steroidal anti-androgen which will actually block the androgenic receptor, causing, it will block the androgenic receptor, right? So the DHT and testosterone cannot bind to AR. In that way, you can actually have a good result when it comes to hair loss, hair growth. And many people have seen really good result. But keep in mind that it has not been approved for proper use for hair loss. This is now just an experimental thing, but people have used it and they have seen really good results. So you can put a massage in your scalp, you can use it once a day. In that way, if you block the androgenic receptor, testosterone and DHT, especially DHT in your hair follicles, won't be able to bind to the AR. And in that way, you will still have circulating DHT in your body, which is really necessary for certain function in your body. But you have this effect because it cannot bind to the receptor, so it cannot produce intracellular signaling for hair loss. So this is new to the market. It's just an experimental thing, and some people have used it and they see good result. So yes, this is my experience on this medicament, and I hope it can help you. Please give it a like. I know it was a long video, but please try to digest the information. If I can rate from the least side effect profile to the most side effect giving medicament, I would say first of all microneedling, less side effect profile. Next up, Nizoral, Minoxidil, and Finasteride. So, by the way, if you are fit and healthy, if you don't have any genetic condition, if you don't have any hair loss in your family, if you start using this medicament when you see a progression of hair thinning or hair loss or telogen effluvium, it's in another word, diffused hair thinning, please consider this protocol, and it can most likely it can help you. But here's the thing: if you don't try this stuff, you never know. For me personally, it has given really good result, and I will continue to use minoxidil, ketoconazole, and microneedling. For now, I will stop using finasteride. But yes, that was my video for today. Thank you guys for watching, and I'll see you guys soon. Peace out.